Thank you very much. And thank you to Bay State Senior Class for having us this afternoon. Um, Quick introduction. Sue already mentioned my name, but important to know that I'm a licensed health insurance representative here for the state of Massachusetts. And we certainly welcome your interest this afternoon. Hopefully, by the end of the presentation, the various pieces of Medicare will make a little bit more sense. Also, quick side note, all of the information that will be discussed this afternoon and presented is specific to calendar year 2022. Each year, Medicare, as of January 1st, updates certain numbers. Many Medicare plans make changes. So again, everything we'll be discussing would be specific to this particular calendar year. So with that, we'll go ahead and get started then. Original Medicare. So one of the pieces that we like to start with, exactly what is Medicare? Medicare is a federal health insurance program. It is designated for individuals that are age 65 and older, also available for people under the age of 65 if they have a qualifying disability, 24 consecutive months of disability, and then also available to any individuals that have the medical condition of end-stage renal disease. This is a form of permanent kidney failure that requires the individual go for dialysis or perhaps may be in need of a transplant. There are two specific components to Original Medicare. And again, this is the red, white, and blue card that folks receive either upon turning 65, if they choose, or with that qualifying disability. So the first piece, Medicare Part A, is specifically designated to pay an individual's inpatient hospital claims, skilled nursing facility, so inpatient rehab, and hospice services, as well as home healthcare services. The second portion of Medicare is your Medicare Part B, and this piece is designated to pay your claims such as physician office visits, lab work, outpatient surgery, preventative services, physical therapy, anything that would take place on an outpatient basis. Medicare Part B is designed to help pay those particular claims. Now, Part A, the majority of individuals that we encounter can receive their Medicare Part A at no monthly premium, as long as they have worked enough quarters, satisfied enough Medicare taxes, which comes to 40 quarters or 10 years, they can receive their Part A at no monthly premium. For those individuals that perhaps have not satisfied the amount of quarters needed, it's important to know that they do, if they're going to opt for their Part A, they in turn have over a $400 monthly premium. But again, the majority of individuals, either by themselves working or through their spouse, are able to obtain the Part A at no cost to them. The next question that often comes up with Medicare Part A is, if I have indeed just signed up and I have my Part A card and I am admitted into the hospital, whether it's for a scheduled stay or perhaps through an emergency room visit, what are my member responsibilities? And Medicare Part A does have a deductible for each benefit period. So again, for 2022, the Medicare Part A deductible is $1,556. This amount applies whether an individual is admitted just 1 or 2 nights in the hospital, or if they should have to be in the hospital up to 60 consecutive days. Now, again, folks will say, am I responsible for this deductible each time I'm admitted on an inpatient basis in the calendar year? And normally we let individuals know that it depends on when the last time they were admitted. And I will give an example in that Let's say someone is in the hospital, perhaps a few days or a week. They come out, they will receive a bill from the hospital, the facility, for their inpatient deductible. And now let's say, 2, 3, 4 weeks goes by and they wind up being readmitted, whether it's for the same condition or another condition. It's important to know they would not be responsible for an inpatient deductible because there has not been a 60-day break in between hospital stays. Likewise, someone could be admitted, comes out, receives their bill for their deductible, and 3 months later, they're readmitted. Yes, they would have another inpatient deductible because there has been a 60-day break in between hospital stays. Also, for an individual that may have to be admitted longer than 60 consecutive days 61 to 90, there is over a 300 and some odd dollar charge per day that begins to kick in. Days 61 to 90, as I said, is over this 300 and something, but days 91 to 150 is over 700 and some odd dollars per day. Now, very rarely do we see someone admitted for this length of time consecutively, but it's just important to know that if you are inpatient longer than 60 consecutive days, you will have these per day fees. And again, as a reminder, everything we are discussing would be for folks that are just using their Medicare A and B card. These are the balances and coinsurance that they may be responsible for. Now, on the Part B side, we mentioned this is designated to pay your outpatient services. However, this piece is a little different. You are required to pay a monthly premium for your Medicare Part B. If you are collecting a Social Security check at the time that you sign up for your Part B, Social Security will automatically withdraw your Part B premium each month. However, you don't have to be collecting a Social Security check in order to take your Medicare Part B. Social Security will bill you on a quarterly basis if you're someone perhaps that's waiting for a full benefit age, if you're holding off on starting your Social Security. Now, the majority of individuals, again, for 2022, are being charged roughly $170.10 each month. However, it is based on your annual gross income. Normally, Social Security takes a look back of the last 2 years' tax filings to determine what the individual will pay for their Medicare Part B. So if an individual's annual gross income is over $91,000, they will pay higher than the $170.10. And I believe a little further in on the presentation, we actually have a chart which breaks down the different allowable amounts and what the individual would be responsible for. Now, the same if someone has just received their Medicare Part B, and they are going for their first outpatient service, whether it be a physician office visit or perhaps some other outpatient service, they do have, in this case, a one-time Part B deductible to satisfy. For 2022, the Part B deductible is $233. Now, after the individual has satisfied the $233 outpatient deductible, Medicare Part B will then pay 80% of Medicare's allowed amount, but leaving the individual or patient with 20% leftover balances for their various outpatient services. Some preventative services may be covered in full so that the individual has no remaining balance. Now, I mentioned a quick graph or chart rather as to what the Part B premiums would look like based on a single person's annual income, or if they file a joint return or file married with a separate tax return. So again, you're seeing kind of a breakdown of the various amounts. And again, these numbers are specific to folks that are signing up for Part B in 2022. But again, you can see the higher the income, the higher the Part B premium. I will mention, because one of the most common questions we receive is, my Part B premium is being based on perhaps my last 2 years' tax filings, but once I'm retiring, my income will no longer be at that same threshold. Medicare, or rather Social Security, will adjust the Part B premium. You are required to go back to them, and I believe it's within a year or two, you can request to have the Part B premium reduced if your income, again, is no longer the same as when you first signed up. Now, original Medicare and adding some additional coverage. So excuse me. My screen is jumping ahead here. Let me just go back real quick here. There we go. So the current slide, page 7, you are seeing the 3 scenarios that we often see individuals use when choosing a Medicare plan. The first area is showing you certainly the original Medicare card with both Medicare Part A and Part B. But it's important to note that Medicare A and B does not cover retail prescription drugs. This is only available through private insurance carriers. So one way we see folks using Medicare is they certainly use their Medicare A and B card for their medical services, and then they have to go purchase what's called a standalone or a separate Part D prescription drug plan. These might be companies like Humana, AARP, WellCare. There are several carriers that offer just a separate Part D prescription drug plan. The second scenario that you're seeing, oftentimes we see individuals, again, using their original Medicare card, purchasing a separate or standalone Part D prescription drug plan, but they may want some assistance or help in picking up the remaining balances that the Medicare A and B leaves them with. So they may consider purchasing what's called a Medicare supplement or a Medigap plan. This type of coverage comes in after Medicare makes its payment and can help pick up remaining balances. The third scenario at the bottom, again, is something called a Medicare Advantage, or they're also referred to as Part C plans. And unlike the supplement plans that come in after Medicare makes its payment, the Advantage Part C plans actually temporarily replace the Medicare card. So although you must have Medicare A and B to join an Advantage plan, if you do determine that that's the best fit, you literally tuck your original Medicare card away. You can place that in a drawer, and the only card that you would be using would be your Medicare Advantage card. You no longer go by Medicare's deductibles and 20% remaining balances for outpatient. You now would go by the set co-payments established under the Advantage plan that you join. Most of the Advantage plans include the Part D prescription drug coverage. So again, this is a quick slide as to the 3 various ways we often see individuals using their Medicare coverage. Now, original Medicare and prescription drug coverage, because one of the first pieces we try and clarify, we know that Medicare A and B gives you hospitalization and outpatient service. But as I mentioned, if you were to take the A and B card to your local CVS or Walgreens or retail pharmacy, prescription drugs would not be covered under the A and B. As I mentioned, you can either purchase a separate standalone Part D drug plan through a private insurance carrier, or if you're determining, gee, I like the Medicare Advantage plans and you need a drug plan, then you want to choose a Medicare Advantage plan that includes the Part D prescription drug coverage. The other piece that we clarify, Medicare Part D prescription drug coverage must follow the federal drug program guidelines. So certainly you will find many carriers offer Part D prescription drug coverage, but if it is an individual plan, we are all mandated to follow the same phases and rules. This particular slide is a quick guideline as to how these federal drug program guidelines work. And quickly, just so that you know, each January, the government updates these phases and numbers. So for 2022, the government has indicated if you are offering a Part D prescription drug plan, you may place up to a $480 pharmacy deductible. That doesn't mean every Part D plan has it at a $480, but that's as high as it can go for 2022. Then Medicare states each Part D plan will have something called an initial coverage limit. We tend to refer to it as a spending limit for the cost of your prescription drugs each year. Almost like an imaginary bank of money given to you right when you take the Part D coverage. For 2022, the coverage limit is $4,430. And as individuals fill their prescriptions, we know they may have a pharmacy deductible to satisfy first, and then they begin paying normally co-payments for their prescription drugs. However, it is not the co-payment the individual hands the pharmacist that gets subtracted from this coverage limit or spending limit. It is the full cost of the medication. So as an example, someone may go to fill their prescription drug, they've satisfied their deductible, and perhaps the pharmacist is indicating it's a $45 copayment. So they pay their $45, but they also see, the pharmacist sees the actual cost of the medication, the full cost, let's say is $300. $300 is then deducted from the $4,430. Each time the individual fills a medication, the negotiated cost through that carrier is deducted from this coverage limit. And for those individuals that perhaps take either quite a few medications or very costly medications, they may use up that $4,430 prior to December 31st, before the end of the year. And for those individuals that use the coverage limit up, they then must go into the next phase referred to as the coverage gap, or in past years, this was referred to as the donut hole. If an individual reaches the coverage gap, now they no longer pay the set copayment they were previously paying. Now they're asked to chip in 25% of the cost of the brand name drug, or 25% of the cost of the generic drug. So oftentimes the individual may be seeing an increase in this phase. Now, for individuals or beneficiaries who qualify for extra help through the prescription drug coverage, they may not have this gap. Again, if they qualify for something called a low income subsidy, or LIS. But for other individuals that reach the gap, they now are chipping in 25% of the actual cost. In this gap, if an individual satisfies or pays out of their own pocket $7,050, they then come out of this gap phase and go to the bottom final stage known as catastrophic coverage. Now, what happens is the individual would be back using co-payments that have been reduced to either $3.95 for generic meds, $9.85 for other medications, or they may be chipping in 5% towards the cost of the medication, whichever is the greater amount. As I mentioned, each fall, Medicare releases the new guidelines and phases and numbers for the carriers to follow. So again, this is specific to 2022. And this is very different than most employer group coverage or non-group plans. Again, this is specific to individual Medicare Part D guidelines. Now, oftentimes we may have a question as to, well, if I'm currently not taking medications and perhaps I have signed up for my A and B, and I feel I don't need a Part D prescription drug plan right at the moment, what will happen? Or when can I sign up for a Part D if I don't initially do this? It's important to know Medicare does mandate that individuals carry Part D prescription drug coverage. However, there are a few categories that are exempt, being if an individual has a veteran's benefit, and perhaps they get their prescriptions through the VA, the government says you don't have to purchase a Part D plan. You certainly can, but it's not a mandate. For those individuals that may have TRICARE or military coverage where they have another avenue to obtain their prescription drugs, or perhaps some type of retiree prescription coverage. But for everyone else that does not fall into one of the latter categories, they're required to carry drug coverage. And for those individuals that perhaps determine I'm just not purchasing it at this point, it's important to know that if they do sign up down the road, Medicare assesses something called a late enrollment penalty, otherwise known as an LEP. The way the penalty is assessed, Medicare takes a look at whatever the national average is of a Part D plan by itself. And right now we roughly say between $33 and $34 a month for a separate Part D drug plan. So Medicare takes 1% of that, 33 cents, and they times that by the number of months or years the person has skipped carrying a Part D prescription drug plan. Whatever that dollar amount is their monthly late enrollment penalty that's then tacked on to their premium. Now, it's important to note that if you are an individual that is working past the age of 65 and you have credible employer group coverage, this penalty would not apply. This would be for individuals that have just A and B and determine they are not purchasing drug coverage. Every fall for those individuals that don't originally take the drug coverage, each fall they have a time frame between October 15th and December 7th that they can purchase drug coverage. Again, based on how many months or years they may have skipped carrying the drug coverage would then determine their Part D late enrollment penalty. Now, original Medicare Part D prescription drug coverage we know is necessary, but for those individuals that indicate, I would like some help with those leftover balances that the A and B card will leave me with. So again, that type of coverage is a secondary insurance that's only available through private insurance carriers, and it's referred to as a supplemental plan or a Medigap plan. Again, to be eligible here in the state of Massachusetts, you have to be entitled to your Medicare Part A and enrolled in your Part B. You are still continuing to pay your Part B premium. The supplement plans are not just available to individuals 65 or older. Again, if someone has a qualifying disability other than end-stage renal disease, they too would be eligible to purchase a supplement. Now, Health New England would be your secondary insurance. As I mentioned, you'd show your Medicare card. They would pay their portion first. And if you've purchased a Health New England supplement plan, we would come in after their payment. And again, it's important to note, however, supplement plans only pick up balances or fill in the gaps of services that original Medicare covers. So it must be something that Medicare determines they cover under the A and B. Also, one of the perks with a supplement plan, normally you can use any provider in the U.S. territories as long as they accept original Medicare. So oftentimes individuals will ask when they purchase a supplement, do I receive a provider directory? And the answer would be no, because you have access to providers throughout the United States as long as they accept A and B. Now, one key piece, as I mentioned earlier, to keep in mind, supplement plans are not like the Medicare Advantage Part C plans. They do not include the drug coverage. So again, that's why you're seeing three separate blocks here. You have your original Medicare, purchasing the separate Part D coverage, and purchasing a supplement if you like. In general, most of the United States has standardized supplement plans that range from supplement A through supplement N. However, here in Massachusetts, it actually has been made a little easier. We don't follow the standard A through N plans. Here in Massachusetts, we are allowed to offer three variations of supplement plans. So we have the Supplement Core, the Supplement 1, and the Supplement 1A. Actually makes it a little easier. Now, eligibility. What do I need in order to be eligible if I determine I like a supplement plan better, that's the route that I feel comfortable with? Well, important again, there are three supplements. However, one of the supplements, the Medicare Supplement 1, is a grandfathered plan. This particular plan, in order to be eligible, you do need to have turned 65 or had Medicare A and B prior to January 1st of 2020. If individuals do not meet that criteria, then basically they have a choice of two supplements, either the core supplement or the supplement 1A. Also important to note, what are the differences? Well, looking at the first supplement plan called the core supplement, it's important to realize that the core plan does not pick up all the different categories that Medicare leaves a balance on. So as an example, we mentioned that Medicare Part A does have an inpatient deductible, that $1,556. For individuals that would purchase the core plan, they would still be responsible for their inpatient deductible. This particular supplement will not pick up that balance. Skilled nursing copays under the core plan. Medicare Part A will cover the first 20 days in a skilled nursing facility in full, but days 21 through 100 has a per day fee that kicks in. Again, with the core plan, the individual would be paying those per day fees. And the last piece that the core plan does not pick up is the Medicare Part B deductible, annual deductible of $233. Most plans will add some type of fitness or wellness reimbursement, but this would vary by plan. And then they also may institute a premium discount. Now, the next supplement, the supplement 1A, picks up all the different balances that Medicare leaves over. Again, as long as it's a covered service, the one piece it does not pick up is that $233 Part B deductible. The grandfathered plan, the supplement 1, picks up all the balances that Medicare leaves over, again, as long as it's a covered service. Now, there are some basic benefits that all Massachusetts supplement plans must cover. The first being they must pick up the Part A coinsurance. So those per day fees that can kick in, supplement plans must pick up those per day fees. They also must provide coverage for 365 additional days after Medicare coverage ends. They must pick up the 20% outpatient balances that Part B leaves over, must pick up the first 3 pints of blood each year, must pick up Part A hospice balances or copayments, and then supplement plans must follow the state of Massachusetts mandated benefits. Now, moving or switching gears completely, original Medicare and Medicare Advantage plans or Part C plans. As we mentioned, these are completely different because although you do have to have both Medicare A and B to enroll in a Medicare Advantage Part C plan, you literally then tuck the Medicare A and B card away. You would only be providing or showing your Medicare Advantage card, and you would now be going by set co-payments based on the Advantage plan and the carrier that you choose. So each year, Medicare does need to approve the Advantage plans for each of the carriers. They certainly need to cover Part A and Part B benefits. They may offer some additional benefits, certain things that original Medicare does not cover. They also tend to add in the Part D prescription drug coverage. Many companies offer HMO Advantage plans, meaning I have to use providers within a network. They may also offer PPO Medicare Advantage plans, where I have certainly access to in-network providers, but also access to out-of-network providers. And again, most of these plans include the drug coverage. What do I need in order to be eligible for an Advantage plan? Well, again, I must have both Medicare A and B, but now I actually have to reside within a certain service area. Service area being I have to reside in Hamden, Hampshire, Franklin, or Berkshire County. Oftentimes, if an individual is calling, let's say from Sturbridge area, Boston, the Cape, looking at Health New England's Advantage plans, we have to advise them that they are not eligible because they have to reside in one of the 4 counties mentioned. Now, most of these Advantage plans also have a fixed monthly premium unless the individual is choosing a $0 premium plan. Most of these plans, as I mentioned, may be PPOs, HMOs, HMO point of service plans, or private fee for service plans. Because these plans require that I pay various medical co-payments, each plan does place a yearly out-of-pocket maximum. Oftentimes, individuals may ask if I were to become extremely ill or something catastrophic, is there a limit as to the amount of medical copays I could be asked to pay in a calendar year? And the answer is yes, these are built into each of the Advantage plans. Now, normally there is a general specific service area and a network of providers so that if the Advantage plan is an HMO plan, meaning I have to use providers within the network, folks are able to either look upon the carrier's website or request a hard copy provider directory. Most of these plans also will cover worldwide emergency coverage, whether it's within the US or even out of the country. In turn, the individual would be responsible for whatever their copayment would be. Some of the additional benefits that have been built into many of these Advantage plans include over the counter items, dental services, fitness and Weight Watcher, discounted perhaps hearing aids and hearing exams, eyewear, and meal services for individuals that have come out of an inpatient setting. Now, important considerations to think about when I'm actually shopping for certain types of plans. So, one of the, or quite frankly, many of the considerations that individuals may take into consideration, the first certainly being monthly premium of the plan. What can I afford, or what would I prefer to spend? Perhaps I like to travel. Do I have access to emergency care outside of the US or within the country? Do I mainly use specific providers right within my residency? And certainly, do I want to make sure that this plan will cover my specific providers? What are the additional benefits I'd like to see built into the plan? Determining what I can afford each month, taking a look at that monthly premium times the 12 months. What are the co-pays based on most of the services that I use? Looking at if I am choosing, whether it's an Advantage plan with the drug coverage built in, does this particular company cover my medications? What would my co-payments be? Is there a pharmacy deductible? And what pharmacies do I have access to? What are the additional benefits built in? What type of fitness reimbursements? Customer service needs. How easy am I able to reach a customer service representative? These are just kind of a brief synopsis of some of the things I may want to consider in choosing a plan. When and how do I enroll in Medicare? Signing up for Medicare. So if you are an individual that is perhaps turning 65 and you have determined you are going to go ahead and sign up for both your Medicare Part A and Part B, perhaps you are someone that's going to retire right at that time frame, Medicare states you have a 7-month window that you can begin this process. You can start 3 months before your 65th birthday in signing up. That doesn't mean the A and B is actually effective 3 months before, but it does mean you can begin to fill out paperwork, call Social Security, or go on to their website and initiate the process. Most folks are eligible, as I mentioned, for their A and B for the first of the month in which their 65th birthday falls. So if someone does not sign up for their A and B for their month in which their 65th birthday falls, Medicare says we're also going to give you 3 additional months after turning 65. Now, more and more, we see individuals working beyond 65. So many individuals sign up for their Medicare Part A for the first of the month in which their 65th birthday falls, but they may hold off on the Part B coverage because perhaps they're planning to keep their current employer coverage. Now, I also had mentioned that if you're collecting Social Security and you are signing up for your Part B, they will pull that Social Security, or that premium rather, right out of your Social Security check. Or if you're holding off, they'll bill you on a quarterly basis. You, as I mentioned, you may be able to delay taking your Part B, again, especially if you are working beyond 65 and you're keeping your credible employer coverage. Important Medicare enrollment dates. So this slide basically reviews that 7-month period I talked about. If I'd like to contact Social Security 3 months before the month of my 65th birthday, I can go on the website, I can fill paperwork out, or I can call and speak with a representative and indicate I'd like my Part A or perhaps my A and B. So again, eligible for the month in which you turn 65. Many folks are not always sure what they'd like to do, perhaps on that month. So Medicare says you do have the 3 additional months after turning 65 if you'd like to go ahead and take your A and B or just your Part B. General enrollment. Very rarely, but occasionally, we may see an individual, as an example, leave their employer group coverage or perhaps turn 65 and sign up for their Part A, and they are not continuing to work and they don't sign up for their Part B. So basically, they just have hospitalization coverage. And perhaps 6 months, 7 months, 8 months, a year later, they determine, now I would like the outpatient coverage, my Medicare Part B. And they have not been carrying a credible employer group plan. Well, they can't sign up for Medicare Part B whenever they like. They would have to do this within what's called the general enrollment period, which runs from January 1st to March 31st. They sign up with Social Security between these dates, but the Part B does not actually become effective till July 1st of that year. This is also where we may see folks incur what's called a Part B late enrollment penalty. Again, if you have credible employer group coverage, normally this is not assessed if you don't take your Part B right at 65. This election period is specific to individuals that did not take their Part B and do not have any other form of credible coverage and wait beyond 60 days. When they do sign up for Part B, as I mentioned, they can only do it within this general enrollment period. Now, the annual enrollment is approaching, and this is something each fall between October 15th and December 7th, where individuals can then make a change in their plan. So perhaps I'm someone with Medicare A and B, and I've opted for an Advantage plan. And perhaps I would like to choose or change rather my Advantage plan. I can't do it at any point in the year, but I can make a change between October 15th and December 7th. Whatever change I make is then effective for that January. This is where we see individuals sometimes adding or dropping prescription drug coverage, moving from one carrier to another, changing from one Advantage plan to another, maybe doing an Advantage plan to a supplement or vice versa. Again, this is a time frame that folks reevaluate, taking a look at all the various options available and trying to determine what will be the best fit for me for the following year. And again, this is called the annual enrollment period. There is also something called the open enrollment, and this takes place the first part of the year. You'll see this actually on the next slide, I believe. Oh, nope, the next one over. So past age 65, one of the most common questions we receive, I'm working past age 65, perhaps a year, 2, 4 years. Can I sign up for my Medicare Part B when I'm getting ready to retire? And how do I go about signing up for a supplement or an Advantage plan? So again, we advise individuals you will be entitled to what's called a special enrollment. We normally tell individuals to start a good 30, 45 days prior to losing their employer group coverage or retiring. There are 2 specific forms that must be completed if you are beyond the age of 65 in order to initiate your Part B. One is a form, the beneficiary form that the individual completes. The other form is an employer form or attestation. This is something the employer fills out indicating you are leaving and you are losing your credible employer health insurance. This then triggers the special enrollment to add Part B in. While you're taking care of this process, most folks at the same time are also trying to determine, do I want perhaps a Medicare supplement plan with a separate Part D drug coverage, or do I like an Advantage plan to start? As I mentioned, the biggest piece with this would be to try and do this as early as possible, which we generally say about 45 days or so prior to leaving that employer group coverage. Technically, individuals do have 8 months from the time they leave their employer coverage to sign up for A and B, but they only have 60 days from the loss of employer coverage to jump into an Advantage plan. So normally we do not see folks wait this 8-month time frame to sign up for their A and B or just their Part B. Usually they are trying to make the Part B effective for the first of the following month after their employer group health insurance ends. Now, what are some other special enrollment periods other than that fall time frame that I can make a change? Well, if someone is moving in or out of the service area, most Advantage plans, if they're HMO plans, there is a residency requirement. So if someone is moving out of state, they are then entitled to a special enrollment at their new residence to look around and choose a plan that is available within that zip code. Again, leaving or gaining employer group coverage triggers a special enrollment. Moving into or leaving a long-term care facility or nursing home triggers a special enrollment. For individuals that qualify for additional assistance, prescription drug coverage, such as a low-income subsidy, they're entitled to special enrollments. There is also a state pharmaceutical assistance program called Prescription Advantage. And oftentimes, if someone qualifies at any of the 5 levels, they are entitled to one free change in the year. The last special enrollment would be switching to a 5-star plan. So each year, Medicare uses a star rating system for the Medicare Advantage plans. And if a carrier has obtained a 5-star rating, this allows folks to move from their current plan to the 5-star plan. Tools to help you shop. So there are many different pieces and materials and websites that folks may use. One of the most important being the Medicare.gov website, your official website for all of Medicare's rules and benefit coverage. Also, if you are working with an insurance agent or a health sales representative through a specific carrier, they certainly in turn can speak specifically to the plans they offer. Also, at local senior centers, there are folks that are called Shine representatives, and they in turn can compare several plans. So I know many individuals may find that helpful. We also like to indicate on this chart important resources. So again, we've indicated the toll-free number for Medicare, the Social Security Administration toll-free number, the State Health Insurance Assistance Program, and the State Prescription Advantage Program. As I mentioned, there is something through Social Security directly to help with prescriptions, but if individuals do not qualify for these thresholds, there is this State Pharmaceutical Assistance Program, which has 5 different levels. So oftentimes, folks, once they come onto a Part D prescription drug plan, they may want to research whether they are eligible at any any level for help. So we've also indicated the toll-free number. How to contact Health New England directly. So we also like to indicate, I mentioned my name is Kerry Trotta. I'm one of the Medicare plan specialists here at Health New England. And so if you do have specific questions, whether you're someone that may be either turning 65, whether it be in 2022, or perhaps in 2023. As I mentioned earlier, if you were someone that is looking further out into 2023, that first week of October, we will have our new plan information available. So you are seeing my direct line comes to my desk as well as my email address. We've also indicated Sarah Fernandez, my Medicare sales manager, and some of my other co-associates, Carla Figueroa, Richard Jagai, Fern Silva, and Michelle Eldridge. This gives you, again, our general sales number, Health New England's website and email address. And then normally this is where we see if folks have any kind of general questions. Certainly if you have very individual questions, we advise you to please outreach whenever is convenient, but it looks like we may have two specific questions. So I'll go ahead and double check. The first one asking, if you take a Medicare Advantage plan that has a drug plan, is that considered having Part D and I would not have a penalty? That is exactly correct. For whether it be Health New England's plans or any of the other carriers, if the Part D prescription drug coverage is built into the Advantage plan, you do not have to worry about any type of Part D penalty. The one side note that I will mention, if you occasionally, folks, there may be confusion, and sometimes on our materials there are, whether it's Health New England or the other carriers, you may see certain Advantage plans that do not include the Part D, and some folks will attempt to then go buy a separate Part D drug plan. Unfortunately, Medicare does not allow that. So I always advise, if you're someone that knows you need Part D prescription drug coverage and you're looking at specific Advantage plans, you just want to make sure you choose an Advantage plan with the D built in. Now, for other individuals that perhaps, let's say, are using their Medicare card or prefer a supplement plan, they actually have to go buy that separate or standalone Part D. But with Advantage plans, you're not allowed to have a standalone Part D. Next question being, are there different carriers for Medicare Advantage plans? Where can I find them? So yes, couple of different avenues. On the Medicare website, so at medicare.gov, oftentimes there's an area that you can key in your zip code, and up will come the various Medicare Advantage plans that are available to you. Also, for those individuals normally turning 65 or opting to take their A and B, they also receive a Medicare and You booklet. And again, within the booklet shows all of the Advantage plans that would be available based on your zip code. And it gives you kind of a brief description of just some of the medical copays that apply. At that point is where we see individuals contact the actual carriers to get the very detailed information, maybe a summary of benefits or a pre-kit, which would go into a lot more detail than the Medicare website or the Medicare and You booklet. Also, Shine counselors at the local senior centers can often lay out several different plans in your area too. Okay, and it looks like we, in the meantime, received another question. My husband is retired military. We currently have the TRICARE derivative U.S. Family Health as our insurance. We will have to give up our U.S. Family Health once he's eligible for Medicare. Second question, it looks like being pay more than we currently do for Medicare Part B or additional to keep the USFH. What changes for me 1.5 years until I'm also Medicare eligible? What I'll mention is, and again, I'm not sure if this is something that you have researched, but it sounds like, are they indicating that just for you, as the spouse, you cannot keep the TRICARE coverage, but he can? Or is it a matter of perhaps both of you are no longer eligible for that coverage upon receiving Medicare A and B? This question may require a little bit more research. I apologize. As I mentioned, I know certainly for individuals that have TRICARE with their Medicare, they're exempt from carrying the Part D prescription drug coverage, but I'm not as familiar with all of their rules as far as keeping the coverage once they have A and B. So actually, if you'd like, I can see I have your name, and I believe I also will have access either to your email address or contact information. I would be glad to try and do a little more research on this specific question. I apologize. I'm not positive, so I don't want to give any incorrect information. In the meantime, before I do respond back to you with that information, though, are there any other general questions that I can address? And we know this is quite a bit of information. And of course, as I mentioned, each January, things change slightly with some of these numbers that Medicare conveys to the carriers. But we certainly encourage individuals with any questions, whether it be additional information on how original Medicare works, Advantage plans, supplement plans. Normally we work with folks, as many of the carriers do, several times before they kind of make a decision. Okay, it looks like we may have another question here. Okay, excellent question. So her question being, I am currently on the Health Connector plan. Do I have to switch to Medicare at age 65? And the answer is yes. There was a time about a year and a half ago that the Connector actually issued a letter to anybody that was approaching age 65, usually a good 60 days prior to their birthday, to advise them that they would need to come out of the coverage to sign up for Medicare and in turn look for what type of plan they might want to take. They have since stopped sending these letters, but I do know that the Connector plans are not for individuals that are Medicare eligible, that oftentimes, whether it be for small business, folks under age 65. So the answer to your question would be yes, that you would need to come out of those Connector plans.
You're so knowledgeable, Kerry. It's amazing how much there is to this. My goodness.
Isn't it? And that's why we always advise folks, as I mentioned, it can be overwhelming. So, as you look, don't hesitate to get in touch with whether, it's Shine counselors, sales representatives, whoever you're looking at, and what carriers to confirm some of this information. And like I said, they certainly can offer you more detailed information. We mentioned this is kind of the Medicare made easy, so the general rules, but again, specific carriers can provide, co-payment information, pricing, enrollment timeframes as well. So I think that may be it, Sue.
Yeah. Yes, I think you're right. I want to thank you for your time. I want to thank the audience for joining us and for the great questions and for you sharing your expertise with us, Kerry.
Oh,
thank
no,
you
I
so
enjoy
much.
it. Thank you, everyone, for joining us.
Well, thank you and have a great day.
Okay. Thank you, everyone.